Women spend more time preparing for birth than they do recovering from it, and that really needs to change. Postnatal physiotherapy shouldn't be a luxury. It should be a foundation to your overall recovery and your long-term health after you've given birth. At the minute in the UK, there is a gap in care for women after they've given birth. So usually you will get a 6-week check with your GP, which will focus on how the baby's doing rather than how mum is doing, and would very rarely include any assessment of your pelvic floor or your abdominal wall. And a lot of women don't realise that a specialist physio even exists, or their symptoms get normalised and dismissed, and they're told that that's just how things are. And common doesn't mean normal, and it certainly doesn't mean that it's not treatable. What does pregnancy and birth actually do physically to your body? So during your pregnancy, you've got 9 months, maybe 9 months plus of increasing load onto your pelvic floor. And there's also a lot of connective tissue, muscle changes, nerve changes, hormonal changes, which then affects the laxity of the joints as well. These changes that you get during pregnancy can lead to symptoms like leaking, urgency of when you need to go to the toilet. You might have separation through your abs. So when you're sitting up, even if that's just sitting up in bed, you might notice that there's a bit of a bulge or a dome in your tummy. There might be a heaviness or a pressure downwards into your pelvis, back pain, hip pain, changes to your posture. If you've had a C-section, there might be some pain or discomfort around your scar or tightness around the scar, even numbness, change of sensation as well. Maybe there is a fear of returning to exercise or an avoidance of exercise at all, and things like running and jumping for fear of maybe leaking when you're doing that. So what does postnatal physio actually do? It comes down to assessment rather than guesswork. So we will do a thorough assessment of your core, of your pelvic floor, so how it's contracting, how it's relaxing, and how it actually functions. We will look at your scar if you've had a C-section, and we will give you an individual rehab plan. So it's about long-term function and preventing future problems as well. Postnatal physio really can lead to life-changing outcomes. So we can get women back into sport and back into sport confidently. We can make you feel stronger. We can make you have more energy. We can prevent long-term problems with your pelvic floor and with your pelvic health in general. So this isn't about bouncing back or getting your old body back. It's about building a strong, supported, functional body that enables you to do whatever it is that you want to do in the future.